I want to be a nurse because I'm very passionate about people who need help.
It's the most rewarding work I've ever found. I mean, I have a real calling for this.
My coach was like, come on, you need to do chest compressions. So she just threw me right in there, and I was doing chest compressions, and it was pretty scary.
The demand for nurses is going to increase by 83%. And a report went to the legislature this year that shows that we'll be 71,000 nurses short by 2020 if we don't take action now to correct it.
This is Mrs. Smith.
It was really intense because I'm pumping this lady's heart, and that's the only way she's gonna get any blood to any of her organs.
I'm gonna go ahead and listen to your heart and your lungs, okay?
Okay. We now have a nursing shortage of minimum 28,000 nurses in Texas. And we only graduate 6,000 in all of our schools in Texas. So clearly there's a huge gap.
If we don't have these nurses, then there's going to be significant economic impacts. If you look at this hospital, the majority of their staff are nurses. The largest group of healthcare providers in the United States are nurses. So if you look at a vacancy right now of 1 to 5, for every 5 nurses you see sitting here, 1's missing.
Go ahead and increase her breathing rate a little bit. Just let them know that.
One of the ways to rectify it is to increase enrollment. However, we also need innovative teaching methods, and we believe that simulation is a methodology that can change that.
Being a part of the simulation experience here has really helped build my confidence, both from the guidance from my instructors and then different kinds of scenarios that challenge the way I should be thinking or looking at different situations. It's really helped me out in the real world in the hospital.
What happened?
I was playing football when I felt short of breath.
The term smart hospital seemed to be very appropriate for what we were doing now and into the future.
What other symptoms do you have?
It uses current high-end technology that we're continually going to upgrade, so it's always state of the science. And it will respond to us in ways that other kinds of low technology could not.
Do you have any pain?
No.
One part of our smart hospital is we have a computer-based simulation program that the students can go, sit down at a computer, and learn to take care of a patient. For example, a patient comes in and is complaining of shortness of breath. That patient is then responsive to the students. They can ask questions, they can ask what their pain level is.
And then that patient on the video actually replies. If you've asked it more than once, a patient may say, you've already asked me that. So it tries to replicate a real situation. And students can do that over and over and over until they get it right.
Does anything make the pain worse?
I told you, I'm not in any pain.
So they're learning in the classroom and applying it in the clinical practice setting here. Then they also go into the clinical area almost immediately and apply it there in a real-life situation. If you learn this faster than another student, you may be able to graduate sooner. Using simulation has been embedded into our thinking now for a couple of years, and many schools are trying to do this.
We have some medications ordered, and so we're going to go ahead and get those to you right now, okay?
That would be great.
Schools across the state of Texas and actually across the nation and the world are trying to address the nursing shortage. But specifically here at Texas Tech University Health Science Center, we have significantly increased our enrollments. In 2001, we had about 245 students. This year, we'll have over 1,000 students.
I'm starting to feel much better.
I'm so glad to hear that.
And Mrs. Simpson, my name's Ryan. This is Leilani. We're gonna help take care of you this morning, okay? Just hang with us.
I'm so tired.
The mannequins are as real as you can get without having a real patient in the bed. They can breathe, their chest rises and falls. You can feel pulses on them. They can speak to you. You can start IVs on them and actually get some blood returned from them.
Mrs. Simpson, I'm going to go ahead and listen to your lungs now, so if you could just take a deep breath for me whenever I place my stethoscope down, okay? I was in a wreck. Deep breath.
But you never know what a student is going to do, and they always come up with very interesting ways to treat a patient.
She's experiencing wheezes bilaterally.
So the faculty member that is involved with the scenario can stand off out of the scene and make the changes appropriate whenever the students make their decisions in the way they're going to treat the patient.
Okay, Mrs. Simpson, this is what we're gonna do. We're gonna have to put an IV in your arm. So I'm gonna take this tourniquet here, I'm gonna tie it around your arm so I can find a good vein, okay? You don't know what to expect. You don't know what signs and symptoms you may see at any time. So the instructors do a good job of changing this dynamic or that dynamic and how you respond to that using your critical thinking skills.
My leg, it hurts. Is it still there?
Your leg is hurting?
In a busy hospital environment, there are many things that could be done. Students have to decide what is the priority, what needs to be done first, second, third, who do you delegate to, what do you do yourself? All of that has to be done very rapidly, almost without thinking. And we believe simulation allows us to do that because we can make sure that you get all the essential experiences right here, right now, rather than going to the hospital, waiting for a patient to come in with that experience.
One thing that we have done, which is something we're very proud of, is we've initiated a second degree program for people that already have a baccalaureate degree or a higher degree in something now so that they can acquire a baccalaureate degree in a very rapid pace in 1 year.
It's so accelerated, there's no way you could go to another program and get the same amount of knowledge in this small amount of time. So this is what makes this work for me.
Do you have any questions about anything?
The curriculum is just as intensive as a traditional curriculum, and they do all of the same amount of clinical hours and theory that a regular student would do in a 2 to 2.5 year or 3 year time frame.
You always want to look at trends and see what your patients do.
Well, the other thing that's really neat with the second degree students is they're here on a daily basis, so there's a lot of continuity of care. They become part of the culture of the unit. You finished with your charting? You want me to take that?
Yeah.
I'll take it, take a look at it, and do an evaluation on it and get that back to you tomorrow.
Okay.
So you have a very experienced clinician that's familiar with the unit. Then you have a student who's paired with that nurse from the very beginning of their program. And they work the entire time and get all of their med-surg experience in that one particular unit. The other thing that's unique about it is that the student does all of the didactic or the theory component of the education online.
I don't even go to a classroom per se. I can be at home with my kids and spend time with my kids and still get my coursework done. That's what I love about this program.
Its structure is so flexible. The main thing is you just have to be motivated and you have to want to learn. You have to know how you learn so you can learn all the information you need to know. It's so intense, but you learn so much.
It really creates an opportunity to identify students. They can remain in their home community and not have to move, and we actually deliver the education to them. We currently graduate about 6,300 graduates a year. Well, to get to that 71,000 additional nurses we're going to need in the future, the schools are going to have to increase their enrollments fourfold by the year 2020.
We already have lots of people motivated to go through that cannot get in. I believe it's a faculty issue, and that faculty issue is a salary issue. Our new graduates make as much as our faculty.
But what we have is a bottleneck of people wanting to enter the field, and then a problem at the nursing schools because we have insufficient funding and insufficient faculty. And so as the demand for nurses has risen, the salary for nurses has risen, but it hasn't had a parallel rise in the academic sector.
What is one of the main things that you need to do when you're talking to Mrs. G?
The nursing shortage is in a crisis situation. It's only going to intensify. We have to take it seriously. It's critical for you as an individual. It's critical for your family. It's critical for your children.
The consequences of not addressing the shortage have already been seen, and that is that there are vacancies in hospitals and they've had to close beds.
So I think we have to have a multifaceted approach, and it has to be something that everyone in this country considers. Policymakers have to take this as a serious issue, and I think they are definitely considering that. Patients need to take it as a serious issue. You need to ask a question when you go into the hospital. Who is caring for me?
Are you experiencing any pain right now?
I had a little bit hard time breathing a little bit.
A little shortness of breath?
A little bit.
Is there anything that
With that kind of collaboration, not only with our partner schools, but with our healthcare partners, our hospitals, we are doing much more now together because we're in this together. And I'm optimistic that together we'll be able to do this.